If you're over 60, there's a warning from cardiologists that most people in this age group have never heard. And it doesn't involve an exotic drug or a rare condition. It's about 5 pills that millions of people take every day without a second thought. One of them could trigger a heart attack, not in everyone, but in the people most likely to be watching this. By the end of this video, you'll know which 5 pills the research flags most often, which one sits in almost every bathroom in America, and, most importantly, exactly what to do about it. And the one that surprises people most? It's not on your prescription list. I've spent years reading the research on drug safety in older adults and translating it for people who don't have a medical degree and shouldn't need one. Here's the honest framing before we go any further. This is not a "your doctor is hiding something from you" video. None of this is hidden. All 5 of these pills carry warnings from the FDA, the American Heart Association, or major peer-reviewed journals. What is hidden is that the warnings are buried in label text most people never read, and the drugs are sold so casually, over the counter, at urgent care, at the health food store, that the idea of a cardiac risk never even crosses our minds. Quick note before we get into it. This is educational content, not medical advice. Nothing here is a reason to stop a medication on your own. Stopping some of these can be just as risky as taking them. Every piece of information I give you today is context for a conversation with your own doctor or pharmacist. They know your full picture. I don't. And here's the open loop. One of these 5 pills is something most people over 60 reach for when they have chest tightness or joint pain, something that feels like it should be helping their heart. I'll tell you which one and why that intuition is backwards in a few minutes. Before we get to the 5, there's one thing worth understanding, because it explains why this list is specifically about people over 60. 2 things happen to your body as you age that affect how medications behave. Your kidneys and liver, which break down and filter out drugs, work more slowly. That means a dose that was perfectly fine at 45 can linger longer and build to higher levels at 65. And second, you're more likely to already have some cardiovascular risk factors: high blood pressure, stiff arteries, a history of a cardiac event. When a pill that can modestly raise blood pressure meets a cardiovascular system that's already working harder than it used to, the math changes. Think of it like this. A small stone dropped on a sturdy wooden floor leaves a scuff. That same stone dropped on a floor that's already under stress can crack it. The stone didn't get heavier. The floor changed. That's the framework for everything we're about to go through. You take it for your knee, your back, after a walk that went longer than expected. Ibuprofen, naproxen, the brand names most of us grew up with, Advil, Motrin, Aleve. These are called NSAIDs, non-steroidal anti-inflammatory drugs. That just means they reduce pain and swelling without being steroids. They're sold everywhere, no prescription needed, and most people treat them like water. Here's what the FDA said in 2015, in language that almost no one noticed. The FDA strengthened its warning that non-aspirin NSAIDs increase the chance of a heart attack or stroke. The risk can occur as early as the first weeks of using an NSAID and increases with higher doses and longer use. First weeks, not years of abuse. A few weeks of daily use. The mechanism is straightforward. NSAIDs work by blocking certain chemicals in the body called prostaglandins. Think of prostaglandins as tiny signals that help regulate blood vessels and prevent clotting. When you block those signals across the whole body, blood pressure can creep up and blood becomes slightly more prone to clotting. Among NSAIDs, diclofenac has been linked to the highest cardiovascular risk, and ibuprofen also raises blood pressure and has been associated with a higher heart attack and stroke risk. Fox News. Now, the balance here matters. For most people, an occasional NSAID for a specific problem is a different proposition than taking ibuprofen twice a day for your arthritis. The risk is greater at higher doses, And patients who already have heart disease have a greater likelihood of a cardiovascular event following NSAID use. Here's your action. If you reach for Advil or Aleve most days, for a knee, a back, joint pain, this is the conversation to bring to your doctor. Ask specifically, is there a safer long-term alternative for my pain given my heart history? Acetaminophen, Tylenol, doesn't carry the same cardiovascular warning and is often the preferred option for older adults with heart concerns. If it's occasionally, after a big walk, once in a while, the risk is different and much lower. The word to watch is regularly, transition. The next one surprises people most because it doesn't look like medicine. It looks like a cold remedy. Winter comes. You get congested. You grab something off the shelf, Dayquil, NyQuil, Sudafed, Advil Cold, and Sinus. Something to get through the day. These products often contain a decongestant, either pseudoephedrine or phenylephrine. That ingredient is what shrinks the swollen tissue in your nose so you can breathe. Decongestants containing phenylephrine or pseudoephedrine can spike blood pressure, which is especially risky for older adults who are more prone to high blood pressure. AARP. Here's how it works. To shrink the tissue in your nose, these ingredients tell your blood vessels to tighten. The problem is, they don't only tighten the vessels in your nose, they tighten vessels all over your body, including the ones around your heart. Your blood pressure goes up. Your heart has to push harder. If your cardiovascular system is already under some strain, that's extra load you don't need. The American Heart Association advises people with high blood pressure to avoid these drugs specifically. And here's the quiet trap. Many people over 60 don't realize they have elevated blood pressure, or they know they have it but think their pill is handling it, so they assume they're covered. They're not. Your action. Turn any cold medicine over and read the active ingredients. If you see pseudoephedrine or phenylephrine, that's the decongestant. Look for versions labeled non-drowsy HBP, or ask your pharmacist for a decongestant-free version. A plain saline nasal rinse works for many people with congestion and has no cardiac profile whatsoever. Transition. Okay, quick check-in here, and then we go to the one that genuinely shocks people, because it's a pill their doctor prescribed specifically to make them feel better. If you've found this useful so far, and if that cold medicine piece is new information, subscribing is the easiest way to support the channel and helps me keep making these for people who want the honest version. That's the only time I'll ask. Back to the pills, and back to the one that surprises everyone. Picture this. You have a chest infection, maybe bronchitis. You go to urgent care and they write you a prescription. 5 days, 1 pill a day. The Z-Pak. Azithromycin, the Z-Pak, has been one of the most prescribed antibiotics in the country for years. It's handed out for respiratory infections, ear infections, sinus infections. People take it without a second thought. And then in 2013, the FDA issued a safety warning that most people never heard. Research found that azithromycin can affect the electrical activity of the heart. The FDA announced it was updating azithromycin labels to reflect the risk of a heart rhythm abnormality called torsades de pointes. Let me translate that. Your heart has an electrical system, like a timer that tells each chamber when to contract. Azithromycin can interfere with the timing of that electrical signal, specifically a phase called the QT interval, which is just the time between heartbeats. When that timing is thrown off, the heart can start firing erratically, which is dangerous. A study published in the New England Journal of Medicine found that patients taking a 5-day course of azithromycin had a higher rate of cardiovascular death than patients taking amoxicillin or no antibiotic, and the elevated risk appeared specifically during the 5 days of treatment. Now, the risk is concentrated in people with existing cardiovascular risk factors. The FDA identifies those at greatest risk as people with existing heart rhythm problems, low blood levels of potassium or magnesium, or those already taking certain heart medications, and notes that elderly patients and those with heart disease may be more susceptible. If you're generally healthy with no cardiac history, the risk is low. But if you have AFib, high blood pressure, or you're on heart medications, this is worth flagging. Your action. Before accepting any antibiotic prescription, mention to the prescribing doctor, "I have your cardiac condition. Is this antibiotic safe given my heart profile, or is there an alternative you'd recommend?" Amoxicillin and several other antibiotics do not carry the same cardiac signal. You are allowed to ask. A good doctor will want to know. If you've already received a Z-Pack, do not stop at mid-course without asking. Stopping an antibiotic partway through carries its own risks. Complete it and have the conversation next time. Transition. Pill 4 is the one I warned you about. The one that feels like it should help your heart, but doesn't always. The fourth pill doesn't come from a pharmacy. It comes from the supplement aisle, the internet, or the health food store. And it's in a category called stimulant-based supplements. These include weight loss products, metabolism boosters, fat burners, and energy supplements. Some are also sold as natural testosterone support for men. The FDA actually banned an ingredient called ephedra in 2004 after it was linked to heart attacks and deaths, including in otherwise healthy adults. Since then, similar compounds have filled the gap. Bitter orange, also called synephrine, is one of the most common. High-dose caffeine in combination with other stimulants is another. The mechanism is similar to decongestants. Stimulants tell the body to speed up. Heart rate goes up. Blood pressure goes up. Blood vessels tighten. For a 30-year-old with a healthy heart, the body handles that burst of stress fairly well. After 60, with blood vessels that are naturally stiffer and a cardiovascular system with less reserve, the same compound can hit differently. Here's the thing. The FDA does not evaluate supplements the same way it evaluates drugs before they're sold. The burden of proving safety isn't on the manufacturer. It's reversed. The FDA has to find evidence of harm after the product is on shelves, which means you can't assume natural means safe, or that because it's on a store shelf it's been cleared for your heart. Your action. If you take any supplement, check the label for bitter orange, synephrine, guarana, a high caffeine plant, yohimbe, or any combination described as a fat burner or energy blend. Bring the full label to your doctor or pharmacist and ask, "Is there anything here that could interact with my heart medications or raise my blood pressure?" This action, bringing the supplement label, is one most people never do. Their doctor doesn't know they're taking it. Transition. The fifth pill isn't one pill at all. That's exactly the point. Here's the open loop, closed. The pill that feels like it should help the heart, the one I mentioned at the start, isn't one specific drug. It's what happens when several of the pills we just discussed end up in the same organizer, on the same morning, in the same body. Research from the University of Southern California, published in a major peer-reviewed journal, found that nearly 1/3 of commonly used medications in older adults have cardiovascular adverse effects listed as a black box warning, the most serious FDA safety label, and that when multiple medications with cardiovascular side effects are taken together, the risk of a major cardiovascular event can double or triple. Think about what that means in a real person's morning. Someone takes their prescribed heart medication, which the doctor knows about. Then they add an NSAID for the knee, which the doctor might not know about, and a cold medicine with pseudoephedrine they picked up at the supermarket, and a stimulant supplement they started a month ago for energy. No single pill in that organizer triggered a conversation. Together, they may be creating a load the heart hasn't been built for. This is the counterintuitive insight I want you to leave with. The pills your doctor monitors most carefully, your blood pressure medications, your cholesterol pills, your carefully titrated prescriptions, those are almost certainly not your biggest worry. The biggest gap is in what nobody's managing together. The OTC aisle and the supplement shelf, taken on top of prescriptions, in a combination no one has reviewed. Your action, and this one is the most important in the whole video. Ask your pharmacist for a medication review. Bring everything, every prescription, every OTC pill, every supplement. Pharmacists are specifically trained to catch dangerous combinations, and if you have Medicare, this review, called a medication therapy management session, may be covered at no cost. Most people have never done it. It takes about 30 minutes and can change things. Quick question, because I genuinely want to hear from you. Of these 5, the everyday pain pill, the cold medicine, the Z-Pack, the supplements, or the combination problem, which one surprised you most? Drop the number. Or tell me if you've already had a medication review and whether it flagged anything. I read these. Let me pull this together, and I'm going to keep it short, because the 5 things I want you to do this week speak for themselves. If you're over 60 and something from this video made you wonder whether one of your pills could be raising your cardiac risk, you're not being dramatic. These warnings come from the FDA, from the American Heart Association, from the New England Journal of Medicine. The research is real, and so is your agency. Here are 5 actions, easiest first. Step 1, easiest tonight. Turn over your cold medicine and read the active ingredients. If it says pseudoephedrine or phenylephrine, ask your pharmacist tomorrow for an alternative without decongestants. Step 2. Write down every pill you take, prescription, OTC, and supplement, and bring that list to your next appointment. Not a summary. All of it. By name. Step 3. If you take ibuprofen or naproxen most days for chronic pain, ask your doctor at your next visit. Given my heart history, is this the safest long-term pain option for me? Step 4. Before your next antibiotic, mention your cardiac profile, even briefly. I have high blood pressure and take these medications. Is this antibiotic safe for me? Step 5. Most impact. Request a pharmacist medication review. Today if possible. It costs you nothing. It catches the combinations nobody else has looked at together. One last thought to sit with. Most of us were raised to think that what the doctor prescribes is managed, and what we buy ourselves doesn't count. The research suggests the opposite is often true. The prescription folder is carefully monitored. The bathroom cabinet, the supplement shelf, the thing you grabbed at the drugstore at 10 p.m. That's the gap. You just closed part of it today. Last question for the comments. And I'm asking because many of you have been managing medications for years. Has a doctor or pharmacist ever flagged a combination or interaction that surprised you? What was it? Your answer might be the one that helps someone else who scrolled past their own warning. I read every comment. Take good care of yourself and of that morning organizer. Pause. I'll see you in the next one.